However, I want to point out that the healthcare delivery system in the 21st century is a lot different than it was in 1955 and 1965. We intend to work with our colleagues at the LHIN and the Ministry of Health. This is several tens of millions of dollars in renovations to both sites. And we're also concerned about all of Chatham Kent, all 120,000 people. Together we must build a system that meets the emerging healthcare needs of our changing community, and particularly chronic disease. Future population changes. We notice what the demographics of this community are doing. But we want to be able to recruit and attract and retain physicians. We're actually building a system for people who aren't here yet.
I'm not going to get into a debate with you about the numbers. You obviously know them much better than I. And really, the municipality has really a very limited jurisdiction in healthcare. But I think we have an interest because a number of years ago, in 2001, this council made a commitment to $5 million to the Chatham Kent Health Alliance. And as you've indicated, some of that money went to Sydenham District Hospital. In fact, as I remember the time, it was somewhat controversial to give money to the hospitals. And it took some selling on our part. And one of the ways I sold it in Wallaceburg was that a significant portion of that money would be spent in Wallaceburg and would assist in keeping the hospital.
As healthcare continues to change with technology, family health teams, community health centers, nurse practitioners, physician assistants, our needs change as well. Human resources have been a critical tipping point in many of our organizations across Canada and within Ontario. With respect to our study, it was important for us to be as transparent as possible with the community, with the data that we have, and the process that we plan to follow through with. Strategic plans to expand primary care, to address quality and safety, and to bring clinics in Petroleum. They had also served Blue Water Health with an ultimatum that they were going to pack up their bags, remove their services from the hospital. Blue Water Health did not have a contingency plan. We saw an opportunity for a crisis in that community. The physicians, with their concessions that they granted us, allowed us to put a 5-year plan together, which allows Blue Water Health to finish building their new building, finish renovating, develop the efficiencies they need. As well, this group of Blue Water Health, the physicians, and the LHIN will work together to develop the recommendations that go to our board in June. And the recommendations are quite clear. It's to evolve the current emergency department to a new model of care, to a better model of care for the community. If you've heard me speak before, I always say we're in a race that will never end. The physician and healthcare professional shortage is real. Each physician retiring today in a community, you must recruit 2 new physicians because of how they practice, the specialty that they want to go into, and quality of life. And that is why it's important for us to develop plans to address our future needs. These issues are complex, and the path to developing the right solution will be difficult at times. However, working together to make sure we have accurate data, that we hear from the community, will ensure that we have developed the right recommendations for each community. Everyone deserves the best model of care we can deliver.